Doctor, you've mentioned dental work, and I think most people don't connect dental work with any sort of disease, much less cancer. How are the two connected, and how should people, I guess, respond after knowing, some of the facts about it?
Yeah, we're here, if I could say, we're here at the Health Freedom
Sure.
Expo
Yep.
in Long Beach, and I just spoke with a patient who I have been talking since October 2011, and it's now February 2012. And she still hasn't made up her mind what she's going to do. And that's okay. I mean, we don't have to push them, but you can't procrastinate either.
Mm-hmm.
And she tells me now that she has 14 root canals. I've never heard such a thing. 14 root canals, and the other teeth are full of metal fillings, and a lot of dental things going on. So she asked me what should I do, and fortunately we have some good biological dentists associated with Hope for Cancer who this is their expertise, this is their field. But that being said, since years and years ago, it has been shown that these dental toxins block healing, initiate cancer and chronic disease, and can increase the progression of these chronic diseases. By example, the biggest thing I've ever seen of a patient healing after having dental work done was in the dental chair. He was John from LA. He was there, and he had myasthenia gravis, a very chronic, progressive disease where the muscles start to lose their tone. And so remember, the muscles of respiration are the diaphragms. And these patients usually die from paralysis of the diaphragm, and they go into respiratory arrest and subsequently cardiac arrest. And so John was having a problem with this, that myasthenia gravis was progressing. In the dental chair, Scott, I couldn't believe it. The work was being done, and he was breathing better, feeling better. It was like almost miraculous. I've never seen something like that, and that made me a believer, because myasthenia gravis, there's nothing you can do for that. It's a slowly or quickly progressive disease, and unknown cause, unknown etiology, as is said. So yeah, dental toxin it's a must. And how is it related to other organs? If we look back at traditional Chinese medicine, Ayurvedic medicine, those things have been around for thousands of years. They have to be of some value, right? And not a fad that came and went. And looking at meridians and chi and chakras and all that, the teeth are organs. This is one thing that we have to understand, is that the teeth is not just a inanimate thing there. It's an organ. Each teeth is an organ, and they're associated with visceral parts of our body as well. So there's maps of these that have been around for at least 100 years where, this tooth is associated with a particular structure in our body. And there's been even scientific studies done on this, that females, and I say females because men can get breast cancer as well, but females with breast cancer, typically in the same meridian, they have either a root canal or a bad crown or a lot of heavy metals in their teeth. And once you start pulling that toxin out, you could see tremendous improvement. And for example, what is this doing, right? Because that's the ultimate question. Yeah. What are these toxins doing? They're depressing your immune system. Every day, it's tapping, draining your immune system, right? And of course, we know that mercury, cadmium, aluminum, nickel, these are all very toxic metals. And so, what is it doing to our brain cells? What's it doing to the heart muscles and many other structures in the body? So, I'm not sure if I answered your question.
Well,
but,
yeah, and root canals, what's the problem with there? That the bacteria gets in those spots, or what?
Imagine what happens with a root canal. We're removing the root, which is the nerve. So a tooth without a nerve is a dead tooth, right? And this nerve, it's just not one nerve. It has a lot of other fibers of nerve structures and also blood vessels. So a tooth, as I said, is an organ. It's dynamic. It's getting nutrients, eliminating waste, each one of our teeth. So when we remove the nerve, we're denervating that tooth, we're killing it. It's just has no source of nutrition, no source of oxygen. It's isolated from the environment, the microenvironment. So as you say, this is a haven for infections. And be it, not always are these infections acute, right? Where someone has fever and pain and swelling. This could be subacute infection, where there's a low count of bacteria, for example, and not enough to cause common overt symptoms, but tapping your immune system every day. So some of the best biological dentists and researchers and scientists in the world say there is no healthy root canal tooth. And today in one of our lectures, I learned that, I don't remember the doctor's name, who was a dentist, and he was the one that founded the American Association for Endodontics, or root canals. And later on in his life, he wrote a book of why root canals are bad for you. So he saw the light, right? And but those things are kind of buried, and no one really knows about the history of this.
Yeah.